Ladies and gentlemen, welcome to the Health and Wellness Pod. I am Dr. Lewis Muchile, and this topic today is actually one of the topics that one of you requested me to actually highlight something about in the comment section. So we want you to know that we take seriously the comment section and we appreciate the support that you're according us. If you're new here, there is a subscription button below. Simply press it and press that notification bell because this is a home of health. So that every time we have this health and brilliant ideas concerning health, you become among the first people to be notified. Okay? So like our videos, share them, use them to educate other people so that we grow as a team. Thank you so much for doing that. If you're a returning subscriber, thank you so much for being part of us, and we celebrate you on this platform. Now, this video is designed to open your head on two things, or rather to just give an insight on two things. And one is the normal delivery, and the other one is the CS delivery, okay? The cesarean section. What is the difference? What are the do's and the don'ts? What are basically the advantages of either method, and which one do I recommend to every one of you? Now, I am a natural person, so therefore I always recommend the natural way of giving birth. I told you once in a live that for you to qualify for a CS delivery, underline the word qualify. So you must have a criteria for qualification for this CS delivery, which basically tells you it is an emergency intervention. It is not a natural way of giving birth. It is a surgical procedure, and therefore that means it is secondary to actually the real and the natural vaginal birth. So I always recommend that women go through the natural process of giving birth so that they get to learn through the process, they get to enjoy it, and a pregnancy is supposed to be taken care of before you even get pregnant. You start taking care of yourself through eating healthy diets, through fasting, through exercises, through the sun, through all these things that we talk about as a holistic approach to healthcare. And this will help you balance your hormones. This will help you lose that weight and that fat. This will help you have a flexible pelvis so that when you get the delivery, when you get the labor, your pelvic expands and your cervix just opens up and you deliver naturally. However, these are the qualifications of the CS. But I want you to also know this, that the modern woman is even afraid of giving birth because of the notion that has been put into their heads by possibly the society that birth is painful and that you can easily, and actually even the medical practitioners who actually perform this CS for the sake of allowances, they have made it easier for you to do a CS than give birth naturally. And that is not okay. Okay. So just know that you need to deliver naturally, and it's very possible. There is nothing, a woman enjoys that pain, and that's the reason why after the delivery you get a bundle of joy, and then afterwards you also want another pregnancy. And that is how the woman was designed, even biblically. So those of you who follow preachings of the word, they already know there is a natural process. That pain has to be endured, and after that pain comes a bundle of joy. Okay? So now, for you to get to a CS, because a CS is actually an emergency, it was designed to be an emergency procedure to just save the life of the mother and the baby, just in case there is a risk that we might end up losing the life of both or even the life of the mother. So we get in to intervene to just make sure that the process of giving birth is normal and it's easier. But again, it's not natural. So the following are the criteria that are supposed to be used to help you qualify for a CS delivery. Number one, if you have delayed labor, they call it protracted labor. That is a qualification for CS. Number two, if you had a previous CS, that can actually be used as a criteria to qualify you for a CS birth or delivery. Also, if the presentation of the baby is in an abnormal position, remember it's supposed to come in with the head first. But if you have another presentation, maybe the baby is not presented in a way that will make it easier for you to give birth, that basically means you have to go through a CS if we can hardly correct it and it's already getting to the termination of that pregnancy. So therefore we need to do a CS. Also remember this, the placenta has two things. One, when the placenta is near the cervix and then closes the cervix so that the baby cannot come out, that is what we call placenta previa. So that means you have to go for a CS delivery. Also, when you have placenta abruption, so the placenta is getting out, is actually disconnecting from the wall of the uterus. That basically means now another CS. Okay. So these are basically some of the qualifications that you need to go through. Actually, you need to experience for them to decide, for a doctor to decide. Now, this lady qualifies for a CS. Also, when you're having diabetes in pregnancy, or even the eclampsia and pre-eclampsia, those conditions that are very weird and they can bring problems during pregnancy, that can also qualify you for a CS. But diabetes actually makes your baby big. So when you have high sugars in the system all the time, you are actually overfeeding that growing, developing baby in your womb. So that ends up giving you a baby with very large mass, and they are unable to pass through the cervix. So that means you have to go for a CS. So therefore, it's very necessary for you to regulate your diets in pregnancy. It's very necessary for you to have these short fasts. And I know the system has brainwashed you to think that when you're pregnant, you're a weak woman. When you're pregnant, you need to be taken care of and pampered all the time. So you need a soft life, as you say. When you're pregnant, you need to just eat and snack all the time. I've seen 5 meals a day and snacking before bed and all this. So just understand that your body behaves the same way to a body that of somebody who is not pregnant. The only difference is now you have something growing in you, and you might end up having more or additional hormones that can actually expose a lot in you. I put up a video talking about how a pregnancy does not cause you the cravings, does not cause you all these issues or the diabetes and that. I told you that the pregnancy just comes in with the hormones, and these hormones totally expose what you've been doing. And most ladies came after me because they thought I was attacking them, and even others said that I need to get pregnant to know or to understand the process. But the reality is this: I don't need to get pregnant to know what you're going through. If at all I have the science of a pregnancy, I understand it. You need to know the science of the pregnancy so that you get to take care of yourself. So the reality is, if a woman has been eating the crap diets all through the inflammatory foods, what do you expect? And that is what our women are eating. It's only now that this information is getting to women and they're getting woken. But previously, a woman who is basically 27, who is 30, for 2 decades or 3 decades, they have been eating inflammatory and unhealthy foods. These are foods that spike their insulin levels all the time. So what do you expect? When the pregnancy comes in, it simply exposes what has been under the water. And now when you get these problems in pregnancy, you start saying the pregnancy came with diabetes, the pregnancy came with this and that. That is so, it's not right. The reality is, you need to change your diets before you even get pregnant. When you change your diets, you're actually preparing yourself for the pregnancy, and then you're also preparing for the life after the pregnancy. Okay, why? Because you want to produce breast milk that is essential and necessary for your child for 6 months straight before you start weaning them to the solid and semi-solid foods. So you need to take care of that pregnancy before. And most of you start taking care of the pregnancy after you've been hit by preeclampsia, after you've had those convulsions, after you've realized, hey, I'm having these multiple organ problems and I'm told it might get dangerous. That's when you start paying attention. But you see, that's very late already. You need to start earlier so that you have a soft pregnancy and then you have a soft life after the pregnancy. Okay? So the differences are this. During natural or normal delivery, what happens is there are a lot of vaginal microorganisms. So there are microorganisms that actually inhabit the vagina naturally. And when you're giving birth naturally, what happens is your baby gets an first encounter with these microorganisms. Remember, inside the womb, when the baby is in the womb, it's a very sterile environment, no microorganisms, and everything is just okay. So they have this bubble around them that is actually protecting them. But when they get out, their first encounter comes in with the microorganisms that are lining the vagina. What does that mean? This is their first layer of immunity. This is the first time they get an exposure to that microorganism, and then the immune system works by keeping memory. So the immune system gets to be spiked and then gets to understand that these are microorganisms, and I keep the memory so that when next time they attack me, I can easily fight them. So it relies on that immunity. So that is the first layer of their immunity. And then the second layer comes with what they are feeding on, the milk and the pre and probiotics that they take through the milk and all that. Okay. So for a child who is born through natural birth, they have a very super immunity. Some of the diseases, actually, most of the research have just shown that some of the diseases like diabetes and hypertension come in babies who have been born through CS and natural birth. Babies when you compare the statistics between babies who are born with natural birth and those who are born with CS, you will actually see there's a lot of issues with babies born through CS. I'm not saying that giving birth through CS is a bad option, but I'm saying it is not a natural way of giving birth, and it should be reserved for emergency cases, because nowadays ladies simply want a soft way of giving birth, and then they actually tell their doctors, what we call the elective CS. They call the doctors and tell them, hey, I need you to book me for a CS. I want to give birth through a CS. So you're actually initiating it yourself, and it's okay. It's you to choose that, but I'm telling you the reality, because this is what is happening. If at all you're going to deliver through a CS, that means there was a deformity. Okay, I'm using that word deformity for the lack of a better word, but that means there was something that went wrong so that you have to deliver through a CS. What went wrong is what we are not talking about. We just want to settle on the CS instead of addressing what actually made you go through the criteria that I just mentioned. So this is the reality. This child who was born through natural birth, perfect immunity. And then, when you're giving birth through natural ways, chances of you producing that breast milk and that bonding with the baby are so high. So therefore, your baby will get breast milk enough. And we know very well that most women are not educated about the technique of breastfeeding. And one day we will talk about that technique, so that you just soak all the nipple inside the baby's mouth so that they don't take in the air and they get the colic and they get inadequate amounts of breast milk, okay, which will bring them problems. But this is the point. So when you deliver through a CS and then you end up having low chances of producing breast milk, first of all, CS is a very, very aseptic technique. So it's sterile technique. No microorganisms on the wound, and the baby is delivered. And possibly, if the baby is a premature baby, they are put in another bubble, which is microorganism free. Then they are put on antibiotics also to prevent infections. But that procedure alone is very sterile. So when you do this sterile procedure, this means that the baby will not get the exposure to the microorganisms that actually lie in the vagina. So they skip the first step of immunity. Now they have an immune compromisation. And the next thing that is happening is, possibly if this mother has been feeding on unhealthy diets and all that, they end up getting low breast milk production, or even none. So they start taking drugs to just activate breast milk production, but nothing is happening. And guess what is going to happen? The next thing that is going to happen is this baby is going to be introduced to the milk formulas. And that is a problem, because milk formulas are actually coming in with preservatives, coming in with soy, coming in with all these the products that are actually highly inflammatory. And therefore, they are inflammatory to the gut of the baby. So number one, they missed out on the first layer of immunity. And number two, we are now starting to mess up their gut. And the guts of this baby are their first layer of immunity again. So if they missed the first layer on the vaginal bacteria, now they are missing the second layer, which is the gut bacteria and the gut health. Now, when you destroy the gut's health, the baby's gut, what is going to happen is we are going to experience these mental health conditions, because remember, there is a direct relationship between the gut and the brain. And also there is a direct relationship between the gut and the skin. So when you start messing up the baby's gut from this early stage, what are you doing? You're going to cause skin conditions in these babies, the allergies, the eczema, and all this. Now, the next thing is, you'll always be in hospital gates and hospital doors to just knock them and give them antihistamines and antibiotics. I will talk about antibiotics also. Now, again, you have these children having all these conditions that are actually labeled very crazy names: ADHD, depression in babies, and anxiety, and all these mental health issues that are coming up. And you can easily see the ratios coming up, because women are actually preferring giving birth through CS. And then because the work woman does not want to breastfeed because her breasts will sag, so what they do is they avoid the breastfeeding part, and they actually take medicines to stop them from breastfeeding. And now they put their babies on milk formulas because they are busy. So now this baby is having problems with the gut. And one of the conditions that is actually very prone in babies, and the system has lied to you that is irreversible, is asthma. Asthma in babies is actually acquired. So nobody inherits asthma. Asthma is acquired. And what causes this asthma? We begin with those foods that we are taking. We begin with the CS baths. Look at the children who have been born through CS and the number of children who have asthma and the number of children who have been born through normal vaginal delivery and the number of cases of asthma in these babies. You will actually see a whole large ratio which shows you the differences. And children born via CS have higher chances of getting asthma. And then these babies, of course, the milk formulas, which are highly inflammatory, so they end up getting asthma because asthma is a chronic inflammatory condition. So they end up getting the asthma. You mess up their guts, and then you add on antibiotics, which actually lower the immunity even more, destroys the gut microorganisms, and that becomes a serious problem. Now you add on the cough syrups, you add on the antihistamines for the skin problems, instead of fixing what is actually causing the problem, which is the gut. You go ahead and fix the symptoms. That is a serious problem. So therefore, I will always advise you to go for a normal delivery if at all you've kept all the factors constant. And of course, if you've been in this channel for the longest period of time, you understand the basics of healthy eating and holistic approach to healthcare. That means by the time you're getting to conceive, you have everything in order. So you'll take care of that pregnancy to term, and then you will have a very healthy and smooth pregnancy. You will have very minimal cravings, if at all progesterone comes with the cravings. You will end up having a normal and vaginal delivery, and now your baby will have breast milk for 6 months continuous. That will mean that this will be a very healthy baby, and now you start weaning off this baby to healthy foods, the sweet potatoes, the butternuts, the pumpkins, the mashed beans, the mashed green bananas, the meats, the soups, the fish, the chicken, the eggs and the yolks, the avocados. These are healthy foods that you start weaning off your baby on, and they start growing with super immunities and no diseases that the conditions that are normally in children will be out of question. But if you don't do that, you will simply be in hospital all the time for antibiotics. Every week you're taking antibiotics. Every week you're taking a cough syrup. Every week you're taking an antihistamine. And because of what you're feeding your babies, the noodles, the spaghetti, the cereals, the sugars, the sweets, the sodas, these are the foods that you feed your babies. And then you start saying, my doctor said my asthma or my baby's asthma is inherited because my mother had asthma or my grandmother had asthma. Where was this asthma or the genes 50 years ago? Why are these genes active just now? Okay, so you are not considering the fact that you're feeding your babies foods that are highly inflammatory, and these babies were born through CS. So the doctor is not interested in that. He's interested in writing a prescription for the salbutamols, for the inhalers, and the steroids. And these are the things that will actually mess your baby totally. So asthma is acquired. In babies, asthma is acquired. So change the diets, asthma disappears. But still continue eating the same inflammatory foods, that asthma is not going anywhere, even with those inhalers, and it shall get worse. Okay, so that is actually the difference between the CS and the normal births, and that's what I wanted to highlight totally, because I want you to understand, as you request that doctor to go and do that CS for you, understand that there are risks that are coming with it, basically, which can actually bring problems, because it's a surgical procedure that is dangerous. And also understand that after the aftermath of the baby that is coming out of that CS birth will end up having a lot of problems in terms of allergies, in terms of asthma, in terms of gut problems, mental health issues, and skin allergies. And this is totally what you need to understand. So the decision of taking a CS birth, if it is elective CS, that lies on you. You can choose to do it, you can choose not to do it. But mine is to educate you about the dangers or the benefits of the two. So it's you to make a choice, and the decisions of the choices of and the consequences of every decision that you make will come to you. They will not care if I advised you about this or if your doctor advised you about a CS. The reality is, for you to do a CS, it must be, you must qualify for it. There must be a criteria for you to qualify for it. Don't just do it for the sake of it, okay? Prefer natural births if at all there's no complication in that pregnancy. I thought you should know that.